So accountability, we all do
Yeah.
better when we have someone that we have to answer to. Doesn't matter what it
Certainly.
is.
Yeah.
We all do better, right?
Yep.
So, if you're going to be held accountable for doing this, this, and this, and they know it's coming, they're going to be much more apt to do it.
Pain isn't just about one joint, one injury, or one bad day. It's your body asking for attention, and the right guidance can change everything. Welcome to the Optimal Health Guide. I'm Michael, the host, and I'm here with Josh Vance, the Optimal Health Guide. How's the week been going so far, Josh?
Well, we're getting going here. It's been Monday, so we're diving deep into the water.
Yeah. That's how the week can oftentimes go. Well, today we're going to talk about something that hopefully can be a real shift in perspective for people. Pain isn't always just about muscles, joints, injury, nerves, like we've oftentimes talked about. Sometimes the real drivers can be things like stress, sleep, hormones, and lifestyle. And if those don't get addressed, people can feel like they're doing everything right, but they're still not getting any better. So before we get to that, I just want to remind listeners that you can submit a question. As you're listening today, you might be thinking about your own situation, something that hasn't quite made sense or hasn't improved the way that you would expect it. And if that's you, we'd love to be able to hear from you and what you're dealing with. You can submit a question at podcast.vancept.com, and we'll be using real questioners or real listener questions to guide future episodes so that we can speak directly into whatever it is that you're actually facing. So here we go. Let's jump straight in. So Josh, just kind of a broad angle, how do stress and sleep actually affect pain in the body?
Well, they both have their kind of individual effects, if you will. Stress has profound impacts on our body, really systemically in a lot of different ways. But sleep deficiency and chronic pain can both increase or amplify pain by lowering kind of our pain threshold. You can also find increased inflammation and then decreased ability of your body to heal. So let's kind of break that down a little bit.
Sure. Yeah.
First, in sleeping, we all know we need sleep.
Yep.
So when we have less than 7 hours of sleep, lack of sleep makes the nervous system more sensitive. So we may find that smaller things in the way of pain, less pain is more intense than it might normally be because we don't have enough sleep.
Yeah.
Another thing is lack of sleep increases inflammatory markers such as cytokines. Okay, big fancy word. Anyway, that drives pain in various different conditions. So the less sleep, the more pain we're going to have.
Yeah.
So
Let me
decreases.
dig into
Yeah, go
Let me
ahead.
dig into that a little bit too. So you've already kind of put the marker on there, 7 hours or
Mm.
more. What about quality of sleep? Because I noticed that's something like I may sleep 7 hours, but I may be waking up in the middle of the night. Is
Well,
that
I would.
equally impactful?
Yeah, I would say yes. I mean, it needs to be 7 hours of good quality sleep. If it's disturbed, and people are waking you up, and because it takes a while for your body to actually get into rapid eye movement sleep. Okay, so if you're constantly being wakened up and then going back to sleep, you're not going to be getting the good quality sleep that we're talking about being able to utilize. Okay.
Right.
So sleep deprivation, okay, if you're not getting sleep, that also dampens your ability to perceive pain and increases, let me restate that. It decreases the ability of the brain, the areas of the brain that kind of controls and dampens the pain, and it increases the areas that interpret pain, okay? So that ability to regulate pain gets messed up, okay? Obviously,
Interesting.
also, deep sleep is needed for repair, tissue repair. That's
Yeah.
when we're healing. All right. So if we're not sleeping good, we're not going to be healing. We're going to have a lot more pain. We're going to perceive more pain. Everything's going to be all messed up.
I see. That makes total sense. It's almost like an avalanche of
Hmm.
circumstances that happen on the other side in the negative.
Absolutely. Okay. So now let's talk about the stress part. Okay.
Yeah.
So chronic stress tends to cause this fight or flight mechanism. Okay. That leads to muscle tightness, spasms, muscle tension, all those things. It also is going to increase the cortisol, kind of like the lack of sleep. You get more stress hormones. Also, it's going to increase your adrenaline too. That's not going to make it easy to sleep. And then so you're going to have that systemic inflammatory condition elevated as well. Okay. Also, kind of like when you're sleeping, it messes with the nervous system because becomes more hypersensitive so that we have a higher pain perception. Even when we have less actual causes of pain, we're going to perceive greater pain. So it really messes all that up.
That's interesting. Yeah. And then I'm appreciative that you're bringing that word perception. It's like the lack of sleep or the increased stress almost like amplifies the way that we receive. That's the way the word I was thinking as you were talking about perceived. It may be the same amount, but our body isn't able to finish that sentence for me, able to respond to it the way that we normally would under lower stress and better sleep. How would
Yeah, I think that's not a bad word. Respond or regulate, that regulating mechanism's whacked up. Okay.
Okay.
We've got that stress. Our body can control it, but it's out of condition. And so we're having to increase what we're getting in the way of that stress. And so we're perceiving greater because it's just not regulating it correctly.
What about, do you have any practical tips for somebody who wants to get better sleep and maybe wants to decrease the stress level that they're facing? Because it sounds like going after both of those could be really helpful for somebody.
Yeah. So to manage those sort of things, definitely you got to deal with both of them. Stress management tactics could be things like exercise. It could be talking to somebody. It could be things like where you're going into a quiet room and you're just trying to decompress a little bit using some meditation, or there's some other techniques that a person could use as well. As far as sleep, I think exercise also, if you physically tire yourself out, you're more apt to sleep. Also, some people need a little white noise. That might be something that could help.
Yeah.
Sometimes prayer or meditation. There's just a lot of different strategies, but, setting regular bedtimes, actually I've recently came into some information where people having a hard time sleeping, if they'll just go up, get out of the house for 10 minutes early in the morning and go look up at the sky, look around is the idea, help to re-regulate your internal clock can be helpful.
That's great. Thanks for those practical tips. I think in a future episode, I'd love to dig in a little bit more too about things like pillows, sleep position, mattress, and kind of pick your brain on some of those topics. So I'd love to dig into that. All right. Well, shifting gears from sleep and stress, what role do hormones play? Like, especially for people in midlife, and how does that connect to pain and weight?
Okay. So in midlife, particularly in women, we have hormonal shifts. With women, we also get the decrease in estrogen and progesterone that can drive weight gain, most commonly more towards the belly fat. Also, we're going to have a decrease in metabolism. So things are going to slow down a little bit. Also, just as we age, we're going to begin slowly losing some muscle mass.
Yeah.
Right. So all those changes can increase the inflammation. They can then increase that chronic pain that we might have, joint stiffness, and again, kind of reducing the body's natural ability to kind of regulate how much pain we feel. So the visceral fat, which is kind of that belly fat, is kind of the worst. And what happens is as that estrogen decreases, the fat gets redistributed from hips to thighs more towards the belly as we age. Okay.
Interesting.
Because of the lower estrogen in women, I should say.
Yeah. Okay.
The problem with that is insulin resistance is linked to that belly fat. So that can then kind of lead us down that road towards pre-diabetic or diabetes, okay, which we don't want to go.
So yeah, it sounds like for women in particular, multiple factors are going on. I know that Well, maybe let's talk about men. Why don't you lay down men, midlife, hormones? I know it may be different, but kind of unpack that for us.
All right. So again, we're going to still have the lowering of testosterone, okay, as we age. Muscle mass is also going to gradually decrease. Metabolism is also going to slow down, making it, again, easier to gain that extra weight. With the extra weight, then we have more possibility of joint issues as well as other metabolic disorders, kind of that whole thing also. The changes in hormones also can increase the cortisol level, like we talked about earlier.
Yeah.
Again, that can lead to higher levels of stress, more fat storage too, which is not a good deal.
So then to go practical, let's say, somebody listening, male or female, is in midlife noticing some of these situations happening around them. What would you point them to in general as tips to be able to actively confront some of these things?
Well, I think one of the big things are being active. I know people with frequent pain struggle with that, but the activity level can vary. But being active, it helps to counteract that muscle loss. It helps
Yeah.
to keep us moving, which helps with the joints. It helps overall, especially if we're active outside, with mood. We get some sunshine, that's good for us. It
Yes.
helps with
Yes.
us in so many different ways. So some light resistance, and that could be something as simple as just standing up and sitting down 10, 15 times, 2 or 3 sets of those a day, or going up 2 or 3 flights of stairs on a regular basis, just to keep those muscles. And of course, it could get a lot more complicated, or,
Sure.
you could go join the gym. You could be a lot more specific, I should say. Do all your major muscles as far as strengthening, which will help combat that muscle loss to a degree, and just that exercise. It's also good for your bones. The more stress to our bones, the stronger our bones stay too. And of course, women also can struggle with osteoporosis as they age also.
Yeah. What about, and I know this isn't something we necessarily prepared for, but I'm curious. I would imagine you've got clients whom you give this exact advice to. Start where you are, activity level outside that is doable for you, but they probably have some internal resistance. What do you have any kind of coaching mantra that you use to encourage them to overcome the internal posture that they might have toward like, oh, I don't want to do this?
Well, I think first of all, you got to find out what it is.
Okay.
So that you got to tease that out and ask some questions to figure out what that internal resistance is. Is it that they hate exercise? Is it that they're afraid they might hurt if they have some chronic pain issues? Is it that they're busy? I mean, there could be just a lot of different things. So it really is going to be very specific based on kind of what their hesitation and resistance to it is.
Great. That's really good. Okay, well, we've got a few topics on the table: stress, lack of sleep, and then hormones. I'm curious how you might pull those threads together with this one. Why is it that some people feel like they're doing all the right physical treatments, but they're still not getting better? How do these things affect that?
Okay. Well, the right treatment's good. Sometimes things take time. When we're looking at muscle strengthening, this is something I have to often tell my patients is, they want results overnight, which doesn't happen. And when we're doing strengthening, I'll educate them that, muscle strengthening takes 6 weeks to begin to change that. We lose that strength so fast and especially as we age over time, we tend to become less active. So we do get a little bit weaker. That strengthening is something that's going to take time. So it's not an overnight sort of a thing. Trying to create a lifestyle of activity. Again, that may vary for every different individual, where their daily tasks are a little bit like exercise, in that they're, maybe doing 10 sit to stands, or they're practicing getting up and down from the floor 10 times if maybe they're aging and having a hard time with that. Or for the athlete, it might be some specific exercise for a specific muscle, but they have to recognize that it's going to take some time. So creating a lifestyle where we're thinking about it, we're engaging in in activities that we enjoy. They need to be something that we can enjoy, making sure that we're sleeping well, we're going to bed at a regular time, we're getting up at a regular time, we're getting some
Yeah.
sunshine, we're, eating lots of fruits, vegetables,
Yeah.
good foods, trying to stay away from all the snack foods and the prepackaged stuff.
Yeah.
Everything we can do, making sure your vitamin levels are okay. Do with your doctor by simply having some lab work done.
Yeah.
All those things are things that are going to help affect us physically, especially if we aren't feeling like we're getting there.
So good, so practical, and so helpful too. And I'm noticing we really are getting into one category of service that you provide, which is wellness coaching. We've spent quite a bit of time talking about specifically physical therapy, a lot of the tools and techniques that you use to be able to help people. But this really is, about kind of living this optimal life with this wellness coaching mindset. So how does wellness coaching support long-term healing beyond traditional physical therapy?
Well, a couple things. Number one, they're going to be here periodically. So I've got their attention,
That's great. Yeah.
right? So accountability. We all do
Yeah.
better when we have someone that we have to answer to. Doesn't matter
So
what it
good.
is.
Yeah.
We all do better, right?
Yep.
So, if you're going to be held accountable for doing this, this, and this, and they know it's coming, they're going to be much more apt to do it. Okay.
Yeah.
I think another thing is sometimes that helps is, hey, I'm paying for this out of my pocket. That's painful, right?
You're
So I'm
right.
going to get the most
Yes.
I can.
Yes.
When our pocketbook hurts, we're going to work a little harder. Okay.
Totally right. It's that buy-in factor. Like, I need to get something
Absolutely. I
out of
mean, how
this. Yeah. Okay.
valuable is it? It's valuable
Yeah.
enough to put some money down on it. Okay.
Yeah.
So that's another thing. Obviously, guidance. Okay. Teaching a person the things they need to know in order for them to get the results that they're looking at and getting towards their goals that they're trying to achieve. And that has to be something that they can do for the long term. So they have to understand what it is. They have to be able to have goals. Setting goals is super important. Being able
Uh-huh.
to create habits that will help foster the ability to achieve the goals and not making the goals super easy, but some short-term goals, some longer-term goals, really communicating and finding out what are those big things that they're wanting to achieve so that we can kind of work with them, in whatever facet that they need.
Yeah.
It may not just be one thing, but it may be several different kind of areas.
That's great. I want to put you on the spot here. I'm hoping that there's a specific person or story that comes to mind with this, but I'm curious, do you have somebody that has come to you because they had a specific injury, and then because you had them, you helped them, come across that threshold and into what you described as a lifestyle of activity? Can you think of somebody who kind of gained those rewards that come on the other side of it?
Yeah, I had this person that I was actually treating their mom for an issue, and they came with their mom, and they told me a little
Independent.
bit that they had some back pain too. And
Yeah.
so I'm like, well, okay, we can help with that. So we start working with her on that, and then she starts telling me a little bit more that she, had to retire medically. She'd had a heart attack, had diabetes, had all sorts of different bypass, like a triple bypass. They couldn't even repair one of the blood vessels. Just in really, really uh, need of a lot of help and just
Yeah.
really struggling. And, just they were in bad shape. And
Yeah.
so we talked for a little bit and decided she wanted to pursue this wellness idea. And so we looked at a few different things. We got him some exercises. Of course, that was to also help with the other issue that we were working on. A lot of education on disease, a lot of education on nutrition. And they really changed their lifestyle to the point of they were able to get off
Brilliant.
most of their medications. They were able to
Wow.
decrease them. When they went back to Stanford, who they followed up with for some of their more significant problems, Stanford was shocked at her blood levels and
Wow.
how much better she was doing. They could not
So
believe it
good.
because most people don't change what they need to in order to heal. Even the cardiologist was surprised because one of the blood vessels they couldn't actually do surgery on, but they'd actually reversed some of that heart disease. So now the
Wow.
cardiologist is interested in some of these things that she was doing. So just
That's
absolutely
amazing.
changed her lifestyle.
Yeah.
The way she cooked, it was a fantastic. I mean, she looked years younger after probably about a year or two in between times where I'd communicated with her.
Brilliant story. And so practically, resonates with what we're talking about. So if you only treat the body, but ignore stress and sleep and lifestyle, recovery can eventually stall. And as you hear in that story, learning to be able to adopt a lifestyle of activity really can make such a radical difference. So if you've been dealing with pain that doesn't seem to fully resolve, or you feel like you're doing the right things, but still not making progress, it might be worth looking beyond just the physical side of it. Advanced Physical Therapy, we take a more complete approach, including wellness coaching, to help address the underlying factors that impact healing. So you can learn more or start with the free consultation at Vance PT. The goal isn't always just to feel better for a few days, but really to experience the optimal life. We also have a resource specifically for women called Graceful Aging, and it really helps deal with and confront some of these things that Josh has been unpacking today. We'll include links for that in the notes for this. Thanks everybody for listening in. So glad to be able to have another conversation with you all. Thanks, Josh.
Thanks.